Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio today with Maynard Nexon healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
We are delighted to have with us today one of the nation's most influential physician leaders, Dr. Georges Benjamin. He is the executive director of the American Public Health Association, which is a 150-year-old organization that champions the health of all people in all communities. With over 25,000 members, the APHA serves as a convener, catalyst, and advocate to build capacity in the public health community and influence policy to improve the public's health. Dr. Benjamin, thank you so much for joining us today.
Listen, thank you very much for having me.
You have been the executive director of the APHA for over 20 years, and you have a deep career in public health. Start us off by discussing why public health should be important to all of us.
You know, I spent the first half of my career practicing emergency medicine. I actually am an internist and an ER doc, and one of the things that you learn is that how sick people can be. But you also get a sense of the fact that prevention is a very, very important component of improving our health. And of course, public health is totally dedicated to prevention, wellness, health promotion. And, you know, some of the greatest accomplishments that we've had in human longevity has been because of public health. You know, the sanitary movement, the move toward addressing infectious diseases, particularly on the prevention side, vaccines as an example, addressing many of the social determinants of health, the things that help us become healthy, and of course, the things that can impede our health. And public health does its best work through policy. And policy change is a core practice and principle of public health. And so, you know, if you really look at, you know, the idea of a pound of prevention basically being worth the importance of cure, public health is what it is. It's all about that. And you learn that when you're in an emergency department, taking care of people whose injuries or illnesses could have been prevented.
Well, Dr. Benjamin, we know the big beautiful bill passed earlier this year, and it has some significant impacts on Medicaid, including imposing work requirements, which have been talked about for a number of years. Can you talk a little bit about how these new work requirements and compliance verification impacts Medicaid and potential access to health care?
Yeah, you know, early in my career, I had a chance to look at workforce requirements because I was on a commission for Maryland, which was looking at welfare to work. And so we learned a lot about work requirements to get benefits. And it turns out that under the Medicaid program, which is a program that is a insurance program now for functionally all low-income individuals and people who have disabilities, people in long-term care. And this program provides health security for those individuals, just like you and I get, hopefully, our health insurance, either because we bought it on the health exchanges or because we get it through our employer. And work is not a bad idea, except that in the Medicaid program, over 90% of the people already work. And not only do they work, but if they're disabled and, of course, therefore not eligible to work, they have a waiver. And if they're caring for somebody and they've gone through an official process, they may have a waiver. So the point is, if this idea of a work documentation requirement, because it's not really a work requirement, it's making people fill out pieces of paper to document your status, even though that status was documented to get on the program in the first place, in many cases, is simply a documentation requirement, which has enormous implications because it's additional burden. Imagine if you had to, twice a year, get your driver's license renewed, and if you don't drive, you had to get an ID because, you know, people get a identification card even if they don't drive in many states. So having to go do that twice a year is a real burden.
Yeah, huge
And
burden.
you and
I wouldn't want to have to
and
do that.
imagine having to bring in paperwork to document your age, your social security number, all kinds of things. It's a real piece of additional burden.
There are additional changes that include more frequent renewals, retroactive coverage reduction, which some say could further limit Medicaid access. Can you discuss these issues and what your organization is doing to advocate for those who would be impacted?
Yeah, so when we had COVID, there was a national effort to expand coverage to make sure everybody could get health care. And then after COVID, the authority for that went away. And so there was what we call the great unwinding. And a lot of people who previously had coverage lost their coverage under Medicaid. Some were now working in a different job and were able to get it through their job. Some were able to go purchase it through the health exchange. But the real challenge we have is that um, it's the cuts under the big, beautiful bill is going to, it's $1 trillion they're taking out of the system. So it's going to cost a lot of people to lose healthcare coverage. Anybody that tells you it's not going to happen, when you look at the work requirements that they put in place and the actual fiscal cuts, people are going to lose coverage through a variety of mechanisms. And so what we're doing at APHA, of course, is trying to make sure that people understand what the impact of those cuts are going to be, because we would like to have Congress reverse them. Secondly, we are working with organizations to make sure that people can minimize the loss of coverage by making sure people get their paperwork in order right now and making sure people understand what they have to do to redetermine their coverage for Medicaid on an ongoing basis. So the other thing we're doing with groups like Families USA and Protect Our Care is to make sure that people are prepared for this. So understand that this is not supposed to actually kick in till the end of 2026, the beginning of 2027. Having said that, however, if you are a governor or a local official who's involved with Medicaid, those budgets are going to be put together starting next January. So even though the administrative aspects of those aren't going to actually hit till later next year, the apparatus to do that has to be put in place now. And by the way, there isn't a lot of additional money for states. So states are going to have to absorb the administrative costs of doing that, which also means that their budget is going to be cut further.
Wow.
Switching gears a little bit to post-COVID, I think history will probably reflect the COVID period as being an example of what public health can do to benefit our entire country. But it also created a significant amount of political unrest and skepticism about things like infectious disease prevention and vaccines. So what is the APHA doing on an advocacy or communication standpoint to educate folks on the benefit of infectious disease prevention when we're in this regulatory environment where we have, as we speak, yesterday, today, more vaccine skepticism becoming part of federal policy? How are y'all addressing that challenge or opportunity?
Well, let's remind us how we got here. So I was a state health officer in Maryland doing 9/11. And we had strong leadership on 9/11. And then we had the anthrax letters a month later, by the way, which was our nation's first documented bioterrorism attack that we knew about. And you had the president provided leadership, the Health and Human Services provided leadership. You had singularity of messaging. You had funding that was supportive of the public health system. You had national educational programs around safety. And then when we had the anthrax letters with all the white powder runs we were doing, people may have forgotten all about that, but we had very, very strong leadership at the national level. Fast forward to COVID, we had very poor national leadership at the national level. We had President Trump did one amazing job of supporting Operation Warp Speed. But then there was poor planning for getting shots in arms. There was a lot of disinformation and misinformation that came out of the White House. Did not have that singularity of messaging. And And in an environment, we had social media where we had a lot of conspiracy theories that were exacerbated by people that are just putting out bad information for a variety of reasons. There were anti-mask groups, there were anti-vaccine groups. So there were so many problems that we were having that were again exacerbated by social media, and the fact that people simply weren't validating the stuff they were passing around. And we had people, foreign actors, who were actually working against the United States by creating conflict. You know, the person that goes into the schoolyard fight and says fight, fight, fight.
Right. Sure.
You know, the
Yep. The
exacerbated,
agitator.
yeah, that agitator. We had that going on. So that created a great deal of distrust of a variety of parts of our sector, and public health was in the fishbowl, and so we got labeled with that as well. So what is APHA doing? First of all, we're trying to make sure that people get the right information. We're a trusted source. We're trying to make sure people get good information. We're trying to partner with other organizations so that the public is given the right information so they can make their own well-informed decisions about their health. You know, most people aren't anti-vaccine, but they may be skeptics about vaccine. They may be hesitant about getting vaccine. So if we can give people the information they need about vaccines, about therapeutics, about what these diseases are like, then we believe the thoughtful person will make a decision that's in their best interest. And, you know, I support vaccines. And, you know, when I was practicing medicine, and I would encourage people to get vaccinated. And if they didn't, I didn't push them away. I continued to work with them to try to show them that I felt it was in their best interest to get vaccinated. And if they didn't do that, then I tried to tell them how else to protect themselves. And I became their advocate, regardless of what their choice was. But I was much more successful in getting people vaccinated because I was a trusted source. I gave them the right information. And by the way, I told them when I know what I knew, but I also was very clear that there are a lot of things I don't know. And I continue to learn to be more, have some hubris in what I do, and to be more humble and know that science is an iterative process and I don't have all the answers.
But I can tell you have a heart for the people that you serve just by what you just said. And you mentioned how we got here, to Matthew's question, leadership, misinformation out there. Now that maybe some Americans have lost their trust or questioning, being skeptical about public health, how do you think we fix it? Is it a messaging issue or a leadership issue, or is it more?
Well, messaging is always important. You got to say the right things, but it's a behavior issue. And what I mean by that is, first of all, you need to give people the right information, you know, in a venue that they trust or from a trusted messenger. And then if you say you're going to do something, you need to do what you say you're going to do. So people, you know, trust is easy to lose and hard to gain. But if you repeatedly are doing the right thing and people see you doing the right thing and they know they can trust you say what you're going to do, even if they may be a little skeptical of you, over time you can win them over. But it does take time. And by the way, it's important for you to get out there before they need you. So one of the challenges that public health has was we had this enormous crisis. And most people know their doctor, they know their hospital, the EMT and paramedics in their community, the fire department, the police department, they kind of know those people. They also wear uniforms, so they're visible. Public health is very invisible, and when we do our best work, nothing happens. And of course, it's hard to sell all the amazing things that you did when nothing happened because of what you did. So what you now had during COVID was a faceless bureaucrat telling you that you had to take a test to know what was going on, you had to wear a mask, you had to stay home, and you should take a shot. And in some cases, you had to take a shot, particularly if you're a healthcare worker. And so people were resentful of that, coming from somebody they didn't know. So one of the things we know public health has to do now is we need to get out into the hood so that people know who we are, so that we're trusted before the emergency. So then we go in front of that microphone and say, look, here's our best advice to you. They're much more likely to trust us, but that takes time. And that takes work. And the hard work occurs before the disaster happens, before the emergency happens. That's when the trust develops.
And it's an ongoing effort because there will be another disaster, there will be another pandemic, there will be another public health emergency that comes up, and we won't be able to schedule it, unfortunately. So in November, the APHA is having its annual meeting and expo. And you're going to have thousands of leaders and public health professionals there gathering in DC. What's the focus of this year's meeting, and what are the priorities for you and your organization going forward?
Well, the theme for this year's meeting is how to make public health a top national priority. The last time we were in DC, which several years ago, we had over 14,000 people here. So it's a big meeting. And we're looking forward to it. It's an opportunity for people to get some of the best science available, for them to network with friends, for us to advocate for the public's health. We're going to go basically from that Saturday through Wednesday. Wednesday, we're actually going to have a rally on the mall for healthcare. So we're hoping to bring hundreds, if not thousands, of people to the mall to advocate for healthcare, to make sure that everybody can have opportunity for optimal health for all, which has always been our theme and our goal in public health for over 150 years. Our interest is in the health of the public and nothing else.
Well, you will definitely grab attention with that many people on the mall when you have your meeting. For citizens who may read about it or hear about it on social media or in the news or whatever, what do you want them to think when they hear the words public health?
Yeah, people are always confused with public health. They often associate public health with health for low-income individuals. Public health is here for everyone. We make sure the water is safe to drink for everybody, the air is safe to breathe for everybody, the food's safe to eat for everybody. When you see that a restaurant has been graded, for those cities that grade restaurants, it's because the health department has gone in. When you see a restaurant's been closed because it's not safe to eat there, it's often because of the health department. When you have a water main break, or you get that boil water alert that you hear over the air, it's because the health department has determined the water is not safe to drink. And so we encourage you to do something, make your water safe before you drink it. So public health is involved in every aspect of our lives, from seatbelts to motorcycle helmets to helping people design communities so they're walkable, bikeable, and green. And when an infectious disease enters the community, we're the disease detectives that search it down, prevent it from happening again, and make people healthy.
Well, we're grateful for your work and encourage you to press on. Dr. Georges Benjamin, the Executive Director of the American Public Health Association, thank you again for responding promptly to our request to join us and for joining us today.
Thank you. I enjoyed it. Good to talk with you.
Thank you. And for those of you who are listening to this episode, we hope you learned a little bit more about public health. And Matthew and the whole crew here, we thank you for joining us, and we look forward to seeing you next time right here on Taking the Pulse, a healthcare and life sciences video podcast.